Good morning, class. My name is Ephraim Makinde. I'm a student of Warden University. I'm taking psychiatric nurse practitioner program. I'm presenting to you today change implementation and management plans for reducing admission rate for patients with mental disorder. I have 6 subheadings. Number 1 is executive summary. Number 2 is a description of the proposed change. Number 3 is justification for the change. Number 4 is details about the type and scope of this proposed change. Number 5 is impacted stakeholders and the change management team. Number 6, which is the last one, is a plan for communicating the change and the description of the risk mitigation plans. Executive summary. Globally, there has been an increase in the rate of readmission of patients with mental health disorder in comparison to the other medical conditions. In healthcare, the high rate of readmission for the patient with mental health are influenced by multiple factors, including medication management, comorbid disorder-related substance use, or poor outpatient treatment and follow-up. There are multiple ways that can be applied to reduce the rate of readmission in the healthcare organizations. A description of the proposed change. To reduce the rate of readmission in the healthcare organization, a proposal for the implementation of a multiple components approach that entails a multidisciplinary patient follow-up. The approach integrates various aspects of patient care, including assessment of patient needs, patient education, medication reconciliation, and provision of telephone follow-up, and arrangement of timely outpatient appointments. The successfulness or effectiveness of this approach is dependent on the components that will be implemented when dealing with the patient with mental illness. The next subheading is justifications for the change. Proper implementation of all components of the approach result is in significant reduction of the rate of readmission. The approach is essential since it enhances communication, advanced care planning, and medication safety. Additionally, the approach ensures enhanced training for management of the mental health illness that commonly precipitate the high rate of readmission. Through patient education, the approach will ensure increased awareness and adoption of healthy and positive way of promoting healing, thus reducing the rate of readmission. Details about the type and the scope of the proposed change. The multiple components approach integrates multiple interventions that can be implemented during the patient care and post-discharge to reduce the rate of readmissions. The interventions include patient education, medication reconciliation, organization of timely outpatient appointments, provision of telephone and home follow-ups, assessment of the patient health needs, impacted stakeholders and the change management team. The key stakeholders involved in the proposed change are the patient with mental illness and the healthcare providers, including nurses, physicians, community health workers, and the social workers. To the patients, the approach will ensure provision of comprehensive care that will be essential in the prevention of relapses of the patient's mental conditions. On the other hand, the approach will improve the quality of care provided by the nurses and other healthcare professions in the provision of psychiatric care. The change management team consists of the nurse manager, psychiatric nurses, nurse practitioners, psychiatrists, and physicians and pharmacists and social workers. A plan for communicating the change and description of the risk mitigation plans. The proposed change should be communicated to the involved team through private messages, conferences, meetings, posters, email, videos, and presentations. Social media platforms should also be used in the communication of the change. For instance, the healthcare organization can create a communication platform consisting of all members of the organization. The risk mitigation plan for the proposed change include identification of the risk, assessment and prioritization of the mitigation alternatives, selection and commitment of the resources needed, and progress monitoring. The references is being cited. Thank you very much.